The stain left by my ball sweat looks like a face. Get ready to laugh and even scratch your head in confusion. Today we're reacting to all of the random medical things that are, quote, mildly interesting. All right, let's dive right in. A twice-used pacemaker I was handed in my first aid course. Originally used in a human, then used in a dog. Cool. Pacemaker, it's an implantable device, typically up here. The cardiologist will then connect wires that are in your heart to help keep your heart beating at an appropriate rate. You don't necessarily need to recycle them, but you do need to change the battery probably about every 10 years. The stain left by my ball sweat looks like a face. Some people just have a very sweaty, warm midsection. The biggest thing you got to worry about is make sure you're not getting like fungus and keeping it dry as possible. Sometimes people use powders to try to keep it dry. Make sure that you're having appropriate clothing on. The US section of this supermarket in Singapore are blocking out nutritional claims of cereals. I don't know why they're covering up the claims, but plain Cheerios are 100% better than the Honey Nut in the sense of, say, for a diabetic diet. You're not having the extra like sugars, carbohydrates, you know, you have honey there. This cloud has some muscle. This cloud is working out. To increase muscle mass, obviously you need to put a extra load on the muscles to demand it to grow and get bigger, and then you need the specific nutrients to then also bulk it on. Our baby wipes kill turtles. Plastic in any product, different types of septic systems or systems relating to toilets, they actually don't want you throwing like these products down the toilet. They actually want you to throw them out in a bin next to the toilet, because some systems are not made to take on these type of paper products, and it can go into the natural water systems, get stuck, can hurt plumbing, those sorts of things. Ken Jung was a physician at the hospital I worked at. He is a trained medical professional, was active, and then switched his career to something he loved to do and went to be a comedian and an actor. Medical terms for different organs. Most medical terms are probably Latin, some probably Greek, but super cool. Skin is derm, stomach, gastric. I got my medical bill in the mail for my emergency room visit last month. Hospital fees, $45. Okay, that's pretty low. Canada has, I believe, a universal healthcare system where you're paying into it in other means. There's also different payment structures and different ways that physicians and hospitals get paid too. The average cost of an ambulance ride in the United States is anywhere between $500 to $1,200 or so. The 1956 hospital bill from where my mom was born, 6-day hospital stay, $107.55 total. That was a long time ago. It's when gasoline was like a couple cents. $107 then. Nowadays it's probably costs anywhere between like $15,000 to $30,000 for a delivery in the United States. These medical patches are called Dr. Pepper. Obviously, it's a different country. It's a pepper, right? So maybe these are like heat patches. Do we actually use this in the United States? Yes, sometimes. I think the Dr. Pepper, the soda, originally was like giving medical claims that it like helped with digestion and then gave vitality and vigor. No, it's soda, and we know what soda does to our bodies. My giant blister from a fire. Whoa. When somebody gets a blister from a fire, it typically is going to be a 2nd-degree burn. With something this large, you definitely would want to unroof it, meaning like poke a small hole in it and drain it out. My deformed hand. Yeah, interesting. It looks deformed because the index finger is the very large finger. That's typically not normal. Most of the time, your middle finger is the longest finger. I'm not going to give you guys the birdie here. Mom's optometrist is wearing Pokemon socks. I love it. I'll wear some random socks or some fun socks, Superman socks, or when pigs fly socks. I'm a normal human being. It's kind of funny. A better pain scale at the doctor's office. These are what I would want to use as well. Literally, I ask on a scale of 1 to 10. Then the other component is everybody's a 10. So in my brain, a 10 is like literally your arms being ripped out, being mauled by a bear, those sorts of things. Squirrel vitiligo. Oh my gosh, it's so funny. So vitiligo is the absence of pigmentation. People can get this where areas of their skin are hypopigmented. Someone took a bite out of this hospital chair. The normal person, could they actually take a bite out of this? Probably not. But if somebody's on like PCP or just psychotic out of their mind on drugs, yeah, maybe. Dominican hospital drills white plastic chair into wheelchair frame. It looks rigged up pretty good. It's useful, it's resourceful, and it still accomplishes the same thing that you need of putting somebody in a chair and wheeling them to wherever they need to go to if they can't walk. This big toilet at the hospital, normal size urinal for scale. We have larger wheelchairs for individuals that are obese. If somebody is obese and you put them on this tiny little toilet, like how comfortable is that? This vending machine at the hospital selling healthy, affordable meals. A really cool, great idea. The question ends up being, how long does it last? Does the food go bad? And how often does it need to be changed out? The bike rack at this hospital is shaped like a heartbeat. Actually really funny, but quite dangerous. If the waves are really peaked like that, you also are very concerned about hyperkalemia as well as hyperacute T waves, which could also be an early sign of a heart attack. Hospitals have rolling papers. I wonder if these are, used for getting to small areas, say like a perforated eardrum or into your mouth. Certain small crevices that actually could be useful to maybe tampen out an area or almost use it like a gauze. They are not those type of rolling papers, if you catch my drift. This urinal has its own stall with a door. I've never seen that before. At least you're getting your privacy.
A little privacy, please!
The thing that always gets me though, if you look right underneath the urinal, there is like a part of the floor that looks like it's broken down. And that's because it's probably got urine on it. If you're gonna use a urinal, get it in the urinal, please. The wording on this poster I saw in the ER waiting room at my local hospital. Please take responsibility for the energy you bring into this space. Your words matter, your behaviors matter. Our patients and our teams matter. Take a slow, deep breath and make sure your energy is in check before entering. Thank you. People are in the emergency department because something bad has occurred or they don't feel well. When they get to that point, they don't take considerations of what they're saying to another individual or doing.
Your accent's very thick.
I think this is really good to be like, okay, let me check myself first and not react right away. So really good. And another thing I need to bring to my hospital and see if we can post these up. Placards in different areas. And you have to wonder, is this for staff or is it for patients? My great grandma's medical bill from 1950, St. Mary's Hospital. X-rays were $5 in the operating room. It was only $2.50. Wow, good old Wisconsin. But look at their medical documentation. What surgery did she have? Who did it? What type of X-rays were done? What single X-rays? Have you guys recently had surgery? What did it cost? Was it like astronomical? These are actually really funny, very thought-provoking. Some made me laugh, some made me kind of second-guess some things and maybe bring up some good stuff for my hospital. Definitely check out this playlist right here, binge watch everything. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.